The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants.
Health Futures has an obligation to put an emphasis on fall prevention, to get the message out there to older adults and their children that this is preventable, especially with September being Fall Prevention Month. Next week, we will be having Deena F. Goldstein and Dr. Nayeri return to give us some insights on ways we can get the message out so we can prevent falls from happening.
It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. It's Friday, and you're listening to Health Futures, taking stock in you. And the Friday it is September 22nd. And for those that are not aware, it's the very, very first day of fall. And for those of us that live here in Arizona, it is a welcome sigh of relief. It means that the 100-degree temperatures, while they may not be completely behind us, they will be shortly. And we're excited for fall. And with fall comes a lot of great stuff. Comes football season, comes Halloween, and the leaves that are changing, but not necessarily right here in Phoenix. So you got to go a little bit further north, and you get a chance to experience that. But the other thing that we get to do in the month of September, and the first day of fall, September 22nd, is we get a chance for those of us that are in the older adult world is to be able to really get out there and recognize the need to prevent falls. And falls are it's something that is very preventable. And I'm sure many people aren't aware of this, but 1 in 4 Americans age 65 and over are falling every year. And that is crazy. I mean, when you really look at it, many incidences go unreported. Approximately 9,500 deaths are attributed to falls. And again, I want to state it is preventable. And I have a couple guests here today to really talk about the concept of preventing falls. And my first guest right up here is Deena Goldstein, and she is with Measurabilities, and she's a repeat guest to our show. Welcome to the show, Deena.
Thanks, Bob. It's great to be back.
It's good to have you back. And if you're just tuning in for the very first time, Health Futures is a show about how our older adult population can live a healthier, happier life. We've been on the air now for 4.5 years, and we're bringing meaningful content to our listening audience so that they can do that. And prevention is one of those things that we need to talk about. And when we sit there and think about falls are completely preventable. And Deena, you and your husband own this company, Measurabilities. You guys are out there advocating for fall prevention. Tell us a little bit about what you're doing out there to help educate our community on how to prevent falls.
Well, first of all, I have to say welcome is fall and the cooler temperatures, and it's also National Falls Prevention Awareness Day. So it's a great day to be talking about fall prevention. I always say intervention is prevention, and aging is something that our bodies do, but falling doesn't necessarily have to be one of them as well. Falls are not necessarily an automatic part of aging. And so what we do, we are fall prevention specialists. We have a physical therapist that provides free home safety assessments. He goes in, he'll help you have an understanding of what is safe and unsafe in the environment, and have you navigate through the environment to see where there's areas based on your own particular physical limitations or diagnosis where there are areas of concern, and he'll make recommendations. then we follow up with clinically guided installation of whatever it is you might need to keep yourself safe. That might be a commode riser, a shower chair, safety grab bars, non-slip for the floor, and things like that. So it's all clinically guided.
You know, and it's interesting. So we're here talking about prevention and certainly how to prevent these falls from happening. But statistics are overwhelming, and I shared just a little bit before, but I want to share some more for our listening audience. 87% of all fractures in the elderly are due to falls. 2/3 of those who fall will do it again within the next 6 months. When an older person falls, his or her hospital stay is almost twice as long as those older patients who are admitted for any other reason. Another stat is people aged between 65 and 69, 1 out of every 200 falls results in a hip fracture. That number increases to 1 out of every 10 for those 85 and older.
Yeah, I mean, the statistics are unbelievable. And the problem, it's not just the hip fracture or the head trauma, it's the ancillary complications that follow. Because a lot of times what we see when people have injuries and they go to rehab and they get taken care of there and they come back home, they're not coming home the same person as, you know, when they left. And in many cases, it's a complete loss of independence because they're no longer able to ambulate in their environment safely. And so it can be a complete loss of independence. So we need to prevent those falls. And especially with hip fractures and things like that, you see people go from being fully independent without a mobility aid to now they need a cane, a walker, and in some cases they may end up not being able to walk at all.
And the education part is the big part because, let's face it, I had the pleasure of this week celebrating a birthday, and I shared with my listening audience that, you know, I am now double nickels. You know, Sammy Hagar, I can't drive 55. Well, I'm at 55 right now, Sammy, and you know what? I truly believe this because I see it with our clients. You know, they still envision themselves being younger. And
Right.
I remember being with my one client, and we had an intervention with her family members, and her family members wanted her to move into a senior living community, and she wanted to stay at home. And she was so hospitable. And when I got there, and I arrived last after the family had met, you know, she wanted to go get me something to drink. And this woman at the time, she was 90 years old. She popped up out of her chair and she just started motoring and, you know, right on carpeting. And, you know, and when we sat down and we had that intervention, I told her, I said, listen, you have to move slower. You're not 40.
Right.
You're not 50 because you could easily go down.
Well, it's true. And especially like you're talking about carpet and different surfaces and the desire is there and we all feel young at heart. But you're right. Our bodies are not always where our minds and hearts want to be. Right. So it's, you know, I think it's really important to communicate to family members and to the person that's at risk for falls. Taking interventions to not fall is not creating a lack of independence. It doesn't mean you're infirm. It actually gives you the ability to be safely independent for longer, especially in your home, which is where everybody wants to be. And the ways to do that are to put interventions in place. And in many, many situations, I guide people to do it well before there's a problem because, you know, unfortunately, in our business, what we do is we see people when they're already putting out the fire after a crisis has happened. But, you know, the news is you don't have to wait for a crisis. And it's okay, you know. Everybody could use a safety grab bar. I mean, I know when I'm cooking, I could definitely hold on to a bar so I could, you know, stir and snack on the other side of the kitchen. So anybody can use it.
There you go. But going back to your point, I mean, prevention. And for our listening audience, if you're tuning in right now and you've got a loved one that is at home and you really are concerned about their gait, their mobility, the way they ambulate. I mean, I look at my dad sometimes and I can just see him being a little steady on his feet. Then you really need to take this serious because, again, falls are preventable. And what I want to get into in our next segment is really talk about some of the safety things that we can do. I mean, you have some great secrets and great successes that you're doing over at Measurabilities. But, you know, again, prevention, you know, I want to talk about 20 things that we can really think about and assess in our home environment or our loved one's home environment to prevent that fall. Because let's face it, I mean, once they do fall, it can spiral so many different ways.
Yeah.
And especially those that are 85 and older.
Mm-hmm.
A lot of the patients, a lot of the clients that we do receive fall and they never walk again.
Right.
They end up being bedridden, and then next thing you know, they're on hospice, and then they're gone.
Yeah.
And it's a shame because I can specifically think about several of my clients that were very independent, very active, and then all of a sudden they fell and they spiraled, and then they were no longer. Well, it's hard to believe we're up against our first break. You know, Deena, we have about 30 seconds. Anything you want to just leave our listening audience before we get into our second segment?
Yeah, I'd just like to say that, it can be a touchy topic, but...
We'll get into it in our second segment. James is telling me we're out. Stay tuned. We'll be back for a second segment.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth. And if you're just tuning in, today is the very first day of fall. It is September 22nd, the second to last Friday of the month. And for us Arizonans, we love the fact that we're getting ready to get into the fall season. But in all seriousness, we talked about in the first segment what this day really marks for us. It is a day that we have denoted as Fall Prevention Day because it is designated as the first day of fall. And in our first segment, I have Deena Goldstein. She's from Measurabilities here talking about fall prevention. And I am honored to have with me right now, I've got Babak Nayeri, and he is Dr. Babak Nayeri, Dr. Michael Babak Nayeri, or is it Babak Michael Nayeri?
Either way.
Either way.
As long as the name does not become the focus of the
Can I call you Babak?
Yes.
Okay. So Babak is the director of Healthy Aging Program with the Arizona Department of Health Services, and he's been on the show before. We've talked about Alzheimer's, World Alzheimer's, and then we also spoke about National Healthcare Decision Day. We're not here to talk about those. We're here to talk about fall prevention. Dr. Nayeri, welcome to the show.
Thank you.
You guys have a big event coming up this evening.
Yes, we do. Thank you, Bob.
I'd like you to talk about it because it is about prevention and it is about getting the word out.
Tonight at the Civic Space Park at 424 North Central Avenue, downtown Phoenix, we are holding an event to educate, raise awareness about the importance of falls prevention, as well as remembering those who have lost their life due to unintentional fall-related injuries.
And as I said earlier in the show, and I'll say it again, preventable. One of the most preventable things out there. And it's all about educating. It's about enlightening our residents in our community how to prevent these falls.
Yes. And, the event is going to be, has been organized by the Arizona Falls Prevention Coalition, a coalition of volunteers statewide. And the committee has worked very hard in putting this event together in partnership with Phoenix Police Department, the Phoenix Fire Department, and the city parks. We do have a proclamation from the governor proclaiming September as Falls Prevention Awareness Month, as well as Mayor Stanton, Honorable Greg Stanton, issued a proclamation for September and today as Falls Prevention Awareness Day. Some of the other mayors, honorable mayors that I must recognize and mention are Mayor Mitchell of Tempe, Mayor Rothschild of Tucson, and respectively mayors from Prescott Valley, Cottonwood, And so there's been a lot of support from the leaders across the state.
There's so many mayors there. We're probably going to be leaving some of them out.
Yes.
But I do want to recognize that we do have an event happening today, and I've shared with the listening audience before that I serve on the Governor's Advisory Council on Aging, and we have Senior Action Day today in Fountain Hills. And if you if you live near Fountain Hills or you're anywhere close to Fountain Hills, we have an event that is going from 1 to 3 o'clock today at the Community Center. It's over 13001 North La Montana Drive, and really talking about the awareness of seniors and really being good stewards in our community to assist them in aging successfully. So let's really get back into talking about fall prevention, because there are some things that can be done. And Deena, you and Sandy with Measurabilities, you are out there assessing people's homes every single day. And the first thing you're looking for are what can we modify in the home or remove in the home so that that person can be safe.
Right. So at the most basic level are obstacles. People go into their home. Remember, if you come out of a rehab facility or a hospital, they've cleared the way. They've made it obstacle-free because they're focused on that you're in a clinical setting. But when we go home, we don't have a clinical setting. So we have to be mindful of rugs, different carpets, things that are in our pathways, have a well-lighted pathway. Anytime you have a slippery surface, you've lost friction, and a loss of friction means greater fall risk. And that is in the number one place for falls, which is in the bathroom. And we can get into that later on. So lighting and also in the bedroom area, getting in and out of bed. Some people put slippers by their bed. Well, if the slippers or footwear is placed where they don't see and they stand up, then that's a trip hazard. So these are obstacles. Cords. If we're sitting in our recliner watching TV and we have cords for the television, not the television, it's more likely the lamp, things like that. Cords get tangled into walkers, assistive devices, etc., and feet. So there's just different things throughout the home. And when Sandy goes in, what we look at when the person's home, we have them navigate the environment. Everything is clinical because it has to be addressed based on how you move through your environment. I can come in your environment and turn around and not, move in one direction, and you might go in your environment and have to turn 3 times to get balance, to stand up, to wash your hair or whatever. So we have to look at that in order to know what to put into place. So it's measured, we're watching your process so that we can make an environment that's safe for you to be as independent as possible.
You mentioned something in the first segment, that we have many people in our community that get discharged from a hospital or post-acute, meaning a rehab facility.
Right.
Nobody's going into their home when they get discharged.
No.
So, a lot of times you and I both know that those people that are being discharged, many of them are there as a result of their home not being safe.
Right. And this is, and I'm so glad you mentioned it, this is a critical gap in care. And I know we've talked about this, Dr. Nayeri, which is when you have a transition from a clinical setting to home, many, many times the provider, and there are many providers that do pay attention to this, but there are many that don't. What's happening now from that clinical setting to home, that critical gap is where we come in because it's not being addressed. And when it's not addressed, that's when we're seeing a lot of falls. People are weak, they're overwhelmed, they're tired. Many instances, they're not physically well yet. And we go in and, I know I've spoken to you, we need care in there because we see that they need assistance where they don't have it, and family members, can't always be caregivers.
Well, we won't indict the place this one patient, my client, got discharged from, but I remember getting a call from you last year, and Measurabilities was in there doing the home modifications, and that person was discharged and showed up at the door, and Deena had a moment where she just said, "Are you kidding me?" There is no way this person lived home alone. And obviously the building that they were in, they let you in so you could modify, but needed a caregiver.
Yeah, they needed help. They actually had just been dropped off via a taxi
service.
And left by themselves with their hospital bag next to them. And I provided them with water and something to eat. But this was an instance, and do you have any family members? Do you have a caregiver? No. Well, we're going to make sure, most importantly, I wanted to make sure this person knew they were not by themselves. They were going to get taken care of. So thankfully, I could call you and talk to you about what they needed, and you guys were amazing. And, whether a person has a family or not, it needs to be addressed, and it can be addressed. And let me just say, you don't have to get out of rehab to need interventions. Interventions are so that you don't have an incident. And whether you're 45, 55, or 95, there are interventions you can put in place so that you don't have to fall.
I noticed you said 55.
Well, I did. I just want to touch on that. And, it's important, okay. Bob. Did you want me to come over and talk?
I might need you to do that, Deena.
You're ambulating well. I just want to say that, and I think, So.
Well, it's interesting. When you are discharged, you do need to have a plan in place. And, I'm going to just give a shameful plug, or shameless plug for you. Not shameful, shameless plug for you, and that is Measurabilities. You mentioned the first name Sandy. Sandy's your husband. He's a physical therapist. And the greatest thing about Measurabilities is they'll do free home assessments.
Right.
And being a physical therapist, he knows what to look for. And he will make sure that that physical space, that living environment will be fall prevention free. And that's the most important thing, is to come in there and assess the home setting to make sure it's safe. So if you're listening in and you have a loved one that is at home, Measurabilities is a great company to call. 480-285-6212 or 480-734-0133. Or you can look them up on the web at measurabilities.com. And again, free home assessment by a physical therapist. It doesn't get any better than that. Sandy Goldstein and Deena Goldstein are the proud owners of that company. And I've got Dr. Babak Nayeri, and we want to talk a little bit more about what we're doing as a community. We're gonna be taken out a little bit by Jet. So this is really cool. And the last tune was awesome, too, by Tom Petty. We'll be right back. It's halftime here at Health Futures.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And it is Friday, September 22nd, and it's Fall Prevention Day in our book, and that's what we're talking about today. If you missed the first two segments, you can catch them right up on our website at cypresshomecare.com. Click on the media button, hit the drop down, and you'll see the radio show button there. You'll catch the first two segments, and you'll catch about 170 others we've been bringing to you for the last 4.5 years. And both my guests here have been on our show before talking about a number of different things. And if you're just tuning in, I've got Deena Goldstein from Measurabilities, and I've got Dr. Babak Nayeri. I introduced him as being the Director of Healthy Aging Program, which is part of the Arizona Department of Health Services. But he also is a clinical associate professor for the University of Arizona College of Medicine, Center of Aging, and College of Public Health. He also is the chairman of Arizona Falls Prevention Coalition. And I wanted to make sure that you have a lot of acronyms after your name, and you do a lot of great stuff here in our community representing many different groups. And those groups are all advocating for healthy living and really, just healthy aging in general. And I had a chance to get to know you and work with you with the Task Force Against Senior Abuse. And as part of the Task Force Against Senior Abuse, that is a task force that was created by the Arizona Attorney General's office. We also have a healthcare committee, and I'm privileged to be an ad hoc member of that, and I get a chance to go there at several times a year. But I also want to recognize a holiday that we are celebrating, and that is Rosh Hashanah, a brand new year, and I want to make sure we give a big shout out to those that observe it, a Lashana Tova, which is wishing them a happy, healthy, and a sweet year. Today is the second day of Rosh Hashanah, and we also have another big holiday coming up next week, and that's Yom Kippur. So welcome back to the show. We're talking about Health Futures. Dr. Nayeri, Babak, would you like to say anything else?
Yes, thank you, Bob. Thank you for the humbling introduction. I'm glad to serve the great people of Arizona. And yes, I do want to give a shout out to all those who are observing Rosh Hashanah. I'm mindful of the fact that people who are observing this holiday were concerned perhaps why we're holding the event downtown tonight from 6:30 to 7:30, Light Up the Night event. We do recognize Falls Prevention Awareness Day as September 22nd, which is established by the National Falls Prevention Coalition through the National Council on Aging. So next year we will be more mindful, and hopefully we won't be overlapping with any holidays and be more respectful of our faith communities. Speaking of age, which you both touched on earlier, I want to make sure that we emphasize that slip and falls are indiscriminate when it comes to age and physical condition. It is not only something that happens to people who are older. It can happen to anyone and any physical condition. Earlier this week I fell because I wasn't paying attention as I was checking my emails and on my phone while I was out walking, and I didn't have the proper shoes, and I walked on this grass with some dew. This is the time of the year we're beginning to get some dew on the grass. There I went. My legs gave way, and I fell, hitting my head on the grass.
Thank God it was the grass.
Well, nonetheless, I did sustain some mild injuries. And
did anybody see you fall?
No, and I was so embarrassed. Usually we're really embarrassed when we fall. We don't want anybody to see it, and it's our pride and ego is wounded. So that this happens often. So having said that, I want to encourage those of you who fall, please make sure if you have symptoms that linger on, or if there's any concerns that you might have sustained an injury, please see your provider. Please see your medical provider and get evaluated. Just yesterday, before I stood up to give a talk and talk about our event tonight, a sweet older lady got off her chair, stumbled over her chair, fell, and had a inflammatory response with a contusion or bruising on her forehead. So this type of thing happens.
I just saw it happen yesterday. I was walking my dog, and a woman fell on the tennis court, and she was, I'm going to say, probably mid to late 60s. She went down, and I went into the tennis court, and I said, "Can I help you, ma'am?" And she goes, "No, I'm okay." And her playing partner said, "I think we're done for the day." And I said, "Do you need help to go into the car?" So you're absolutely right. And I, too, Babak, I've fallen. I brought my dog with me, Lacey, and it was the dog I had prior to Lacey. I made the mistake of having the Frisbee in one hand, and he was healing on the other hand. He walked right in front of me. I went right down. You talk about embarrassment. Went down. I had a little bit of road rash on my hands because I was able to catch myself. I rolled over. I looked around to make sure no one saw me. But I did get up, and guess what? I fractured my wrist. And I ended up being in a cast for 6 weeks.
Well, and these are stories you hear all the time, and there is no age to falls. You're absolutely right, Dr. Nayeri. And the thing that's important when you talk to people, they'll say, "Oh, it was nothing. That never happens. Oh, I was just, So I'm not advocating for carrying a banana peel to make it look like it was an accident that was preventable. But don't underestimate when little falls happen. And like you said, if they continue to happen, then you need to address, why is that happening? Is it neurological? Are you having, auditory issues that affect your balance? Is it your footwear? Is it environmental? So it's sort of a holistic approach.
Excellent point. And Bob, also you reminded me to mention pets can also cause falls.
Exactly.
Especially in our home environment. They want to be playful, and they sometimes get in our way. Or
they sleep, and they lay down next to you, and you don't realize it. Next thing you know, you're tripping over.
Or at night when you don't have a well-lit environment at home, and you don't see the pet or something that you can trip over and fall. Those are all things that we can avoid and prevent.
You know what else is it? I always talk about this. In the kitchen, you're unloading the dishwasher, the top rack. What happens when you pull several glasses out? There's always water residue. Well, by the time you've unloaded a whole top rack, there's water on the floor that you're not attentive to, or nor do you even know it's there. So, or pets dribbling from their water dish. So these are things that people don't typically look for. But boy, if your foot hits the water on the floor, it doesn't take much to fall. You lose what's called the coefficient of friction on your floor. The friction level goes down. So.
And Deena, you just touched on something else that's important: wet surfaces and showers and tubs. You know, it's especially if you have a water softener in your home. Well, that makes the water slippery and makes the surfaces more slippery. So be very cautious when you get in and out of the tubs and showers. There are these anti-slip strips and mats that you can use. No, but the strips, Deena is pointing out to me, says
no strips.
No strips. So what would be the best way to at least reduce the slippery surface in the shower, Deena?
You know, I'm so glad you asked me that, Dr. Nayeri. So, ironically, we have a non-slip product that we apply to showers, tubs, floors. We can do it outside the home. A lot of people do it around their pool decking. And what it does, I refer to the coefficient of friction. So it's kind of like a perm, even though I'm sitting here talking to two men who probably have never had a perm in their life. But a perm, when you put the chemical on, the root opens up the follicle. So we treat the floor at a molecular level, and then we neutralize it. And what it does, it increases the friction level. And the only time you notice it is when the surface is wet. You'll notice that you have an increase in traction. And that, it's been scientifically proven, and we've spoken to people about this, Dr. Nayeri, that the increase in friction level greatly reduces falls. So
I was going to say, it sounds so scientific. Molecular structure.
Yeah.
You know?
It's called you don't slip anymore because there's more friction there.
Well, and that's good.
Yeah.
I mean, and again, you know, when we come back for our fourth segment, I really want to talk about ways we can prevent falls, because we know that falls can lead to death and lead to major injuries and major complications in healthcare. So,
Indeed.
You know, one of the things I said at the very, very top of this show was this is one of the things that's preventable.
Right.
It's so preventable, and it's one is removing these things, but two, telling people to slow down.
Right.
We're up against a break. You're listening to Health Futures Taking Stock in You. I've got Dr. Babak Nayeri and Deena Goldstein here. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, and we're on our fourth segment. If you're just tuning in, we are really focused on fall prevention. And as I said, as we concluded the third segment, this is one of the most preventable things to have occur for someone, especially an older adult. And as Dr. Babak Nayeri shared with us in the third segment, you don't have to be old. It happened to him. It's happened to me. It's happened to a lot of people. But I want to really get a chance to I want to punt it over to you, Dr. Nayeri, and just say, do you like that football metaphor?
Yes.
You know, we're playing Monday night against the Cowboys.
That was a real touchdown, Bob.
Thank you. So I want to punt it over to you and really talk about ways to really improve balance and prevent this.
Let me start off by sharing with your audience that in 2016, which is the latest data that we have available, we had 1,008 people die in Arizona.
In Arizona.
974 of them were Arizonans. So you can quickly ascertain that this is something that happens often. 1 in 3 people over the next 12 months will fall.
Right.
So one of us in this room, I think I've already improved the statistics by having fallen this week.
There you go.
Maybe, hopefully, the two of you will be exempt. But the thing is, we can prevent these, as you said. We can have our eyes checked routinely every year. We can have, and please clean your prescription glasses or reading glasses, because oftentimes I see people who don't clean their glasses, and it makes it really hard to see. Get your hearing checked when you go see your provider. Get a referral to get your hearing checked. Medication management. Ask your doctor to go over your medications with
Absolutely.
you. Or if your doctor has limited time, make sure you schedule that with their office staff, their nurse, their nursing assistant, their medical assistant, and go over your medications. Ask questions. It's your right to know what's going on with your medications. Include all your prescription, non-prescription, and even supplements when you share this with your provider. Another thing that you must do, that we encourage you to do, is to get rid of expired medications properly. There are places where you can get rid of your medications. If you have questions, talk to your pharmacist. Pharmacists are great resources when it comes to your medications and your over-counter as well as your supplements. The other things that we can do is get assessed for risk of falling. And we're not talking about, even though it's season fall and autumn, we're not talking about the fall season. We're talking about slip and falls again, if you're just joining this show. And the only thing that we want you to do is to fall in love, not slip and fall. In order to prevent these slips and falls, and it's important to get assessed. Your providers can use various evidence-based tools to assess you. There is the Center for Disease Control and Prevention has an assessment tool that's been well researched called Stopping Elderly Accidents, Deaths, and Injuries. Again, Stopping Elderly Accidents, Deaths, and Injuries, and it's abbreviated as STEADY. And the information is available. There are tools on the CDC website. There are also tools available and links available at the azhealthyaging.com, which is the quickest way to navigate through the Healthy Aging website under the Arizona Department of Health Services. There is a list of programs, evidence-based programs, including Tai Chi for Health. There are many forms of Tai Chi, but Tai Chi for Health and Tai Chi for Arthritis are the two evidence-based programs endorsed by CDC, again, Center for Disease Control. And a Matter of Balance is another evidence-based tool. There is also Silver Sneakers program. There's Otago. Since you mentioned Sandy Goldstein, who's a physical therapist, the Otago can only be delivered by a physical therapist. So that's the challenge there. But other programs you can get involved with. There's a list of 10 things that you can purchase under $20 or less. Or $20 or less, not under $20 or less, but $20 or less. Those things can be found on the blog and the weekly news that our director, Dr. Kara Christ, posted on her blog page. So you can go to the Arizona Department of Health Services, go to her blog, search for falls prevention, and you can find that archived as a list of things that she recommended on her blog. The Center for Medicare and Medicaid Services, CMS, does have performance measures and does have recommendations for providers to perform annual screenings, risk assessment clinics for risk assessment screenings. Sorry, I said cleaning.
No worries.
Screenings for falls to include as part of their annual Medicare visits. So there are provisions for that. There are codes for that. If you're a provider or if you are married to a provider or know a provider, please share that with them and let them know. Thank you.
Babak, I can't thank you enough for going through all that. And, it is, again, something that is preventable. And I want to make sure that if you have an opportunity this evening, they have, it's called a Light Up
the Night.
Light Up the Night event, and it's over at the Civic Space Park, and that's at 424 North Central Avenue in Phoenix from 6:30 to 7:30. Please stop out. You will definitely appreciate it. And they get a big crowd out there for this. This is a big deal, and this is really a big deal if you're listening in and you have a loved one that is aging and doesn't have to be 75 or 85, can be 55, but just be mindful of their home settings to make sure it is safe. Deena, I'm going to toss the ball over to you and have you conclude for us.
All right, I'm going to run with that, Bob. Thank you.
You got it.
So if you're unsure of your environment, if you are getting out of a rehab setting, or you just are concerned, give a call. It's a free home safety assessment performed by a licensed physical therapist who can make recommendations, talk to you about your concerns, what you need. And a lot of times these are topics that are challenging to discuss with family members. So having a third clinical party who can take a clinical history, can understand a history, and we also understand the dynamics, the emotional dynamics that are involved, because this isn't just about physical potential loss of independence or changes in the environment. This is about the new normal. And that's okay. A new normal is just a new normal. And a new normal might be a grab bar. It might be, you know what, you need to be smarter about how you're navigating the environment. We've been in people's homes where they are using chairs for mobility aids through the house.
Well, you know what's interesting, and I want to just say this about measurabilities. You get a free home assessment by a physical therapist. He's been practicing physical therapy for over 20 years and has got a great practice. But not only does he do the free assessment, but your company, Measurabilities, will do the installation of those recommendations.
Clinically guided.
Which is big deal. Ergonomically set up.
Yes.
Well, it's hard to believe, but we're done. Health Futures, taking stock in you. I really appreciated Dr. Babak Nayeri, Deena Goldstein. Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.